this is Dr. Victoria Givens, your facial plastic surgeon with Givens Facial Plastic Surgery in Austin, and we are going to be talking about facial liposuction. Get a lot of patients and clients coming in asking me, how do I get rid of this excess fat that is starting to accumulate under my chin, or what I call the submental and submandibular region, and sometimes extending into the neckline. They generally are coming in so that they can improve their overall aesthetic appearance of the chin, jawline, and neck angle, and even sometimes that neckline. Now, before I get into the physical process of facial liposuction, I want to talk a little bit about weight gain or fat accumulation in this isolated region. So, a little bit of medical terminology is the word hypertrophy, and the other word is hyperplasia. So hypertrophy is when you have a set number of items and they actually increase in size, not in number, whereas hyperplasia is when you have a set number of items but they actually increase in number. So those are two different terms that are important to remember, but let's put an example with actual weight gain clinically. So most patients or people believe that when they're gaining weight, they are increasing the number of fat cells that are sitting, say, under their chin, and when they're losing weight, they are getting rid of fat cells, and that's not the case. That would be a hyperplasia, and that's generally not what happens. What actually happens is more of a hypertrophy of the fat cells, meaning you already have a set number of fat cells, and when you gain weight, they expand in size, which makes it look like you have a larger area under here. And when you lose weight, you keep those same number of cells, you don't get rid of them, and they actually decrease in size, so you have a more defined appearance. Now, hyperplasia can occur, meaning you can increase the actual number, but that generally only happens when you have someone with an extremely high body mass index who is, say, morbidly obese. Then you can incite new fat cell precursors such as adipocytes to form, but in the general population, it's more of a hypertrophy. You have those set number of cells, especially under the chin, that just expand and decrease as your weight fluctuates. So now that you understand the science behind it, I'm going to go through what facial liposuction does, and I think you'll understand a little bit more about the procedure. Facial liposuction is when I make a very small incision under the chin, every now and then right under this earlobe as well, and I take a small cannula with some suction on it, and I actually go in, and in a fan-like pattern under the skin, I remove those fat cells that are sitting there. So I'm physically taking away those fat cells so that they can't be there anymore. And you have to understand, when you remove those cells there, you cannot reaccumulate them. They are gone forever unless you gain a substantial amount of weight or become morbidly obese. Then new cell precursors can form. But like I said before, in general, once those cells are removed, even if you fluctuate a little bit up and down in weight, they are not going to occur back here because they're physically gone and removed. So now that you understand the science behind fat accumulation and weight gain and weight loss or fluctuation, as well as the process of liposuction, I want to go into who is the best candidate for this. Now, it may seem like everyone is a great candidate because if you have fat, you just remove it, but that's not necessarily the case. There are some factors that we need to talk about. One is that even with the best diet and exercise as we get older, sometimes it is really hard to get rid of this. It's just an isolated pocket of fat in this region, and it's just difficult to remove even with the best schedule and best terms. You also have to understand there are some people that it's genetic or hereditary. You may look at some of your family members and they have an accumulation of fat like you, and it gets worse over time. Now, to determine who is a candidate for facial liposuction only, we generally have a little bit of a range, but generally a younger patient, say in their 40s or younger, that really has just an isolated pocket of fat here, doesn't have a ton of skin laxity, and doesn't have a bunch of hanging banded platysmal muscle here. So that's a patient that is a great candidate because not only do you have that effect of removing some of that excess fat, if you have a small amount of skin laxity, it can help to tighten this area as well and define the jawline. However, if you're a more mature patient that has, say, excess fat, dangling skin, and dangling muscle, facial liposuction by itself is not the best procedure. It is a good procedure, but you generally need to add something like a facelift or the Austin custom lift to your treatment. And the reason is you can go in and just suction out that fat, but while you get rid of the fat, you make some of the other age-defining abnormalities more prominent. And so that is why it is really important, and I always encourage a personalized one-on-one consultation with me to determine if you are a good candidate for facial liposuction, or if you need additional procedures as well, or a totally different procedure. So as always, if you're ready to transform your life, it's time to call me at 737-787-8200 or email me at office@givensmd.com. Looking forward to seeing you soon.